Okay, let's continue with the last session. Okay, so we are only going to look at terminologies and how to diagnose the conditions. Okay, when to know when we have metabolic acidosis or respiratory acidosis and those kind of things. Good. So broadly, we can group acid-base disorders into two. Okay, we have the metabolic ones and then the respiratory ones. Okay, metabolic disorders and respiratory disorders. Now the concept is that the metabolic disorder, now if you remember, I showed you guys an equation. Okay, let me go back to that equation. Okay, good. So I showed you guys this equation. Okay, the equation of the bicarbonate buffer. So this ratio over there, which is HCO3 minus divided by the partial pressure of carbon dioxide. Okay, if something happens to this HCO3 minus, okay, then it gives rise to the metabolic one. So the metabolic ones affects the HCO3 parts, and then the respiratory ones affect the the partial pressure of carbon dioxide. Okay, and it makes sense. Okay, so the respiratory ones are going to affect the partial pressure of carbon dioxide. If the carbon dioxide levels are raised, then we have an acidosis, which is from the respiratory system. So we have respiratory acidosis. Okay, if the carbon dioxide partial pressure is very low, then we have respiratory alkalosis. So the respiratory types have to do with the partial pressure of carbon dioxide. Okay, then the metabolic types have to do with the concentration of HCO3. Now I'm using the term directly. Okay, this word is a very important word. So respiratory disorders affect directly the partial pressure of carbon dioxide, because later on we will know that, okay, we will see that the partial pressure of HCO3 might also be affected by a respiratory disorder, but that one is as a result, or that one is an indirect effect. Okay, so the direct effects, so the respiratory disorders affects the partial pressure of, so I'm saying that the respiratory disorders affect the partial pressure of carbon dioxide directly. It's a direct um, cause. Okay, it affects it directly. I'm saying that later on we will see that we have some respiratory disorders. Okay, and then we see that the bicarbonate concentrations have been affected. Okay, the reason why the bicarbonate levels have been affected is because of compensatory mechanism. The primary one is the partial pressure of carbon dioxide. So that's why we're saying that the respiratory disorders directly, this is the word, directly affects the partial pressure of carbon dioxide. And metabolic disorders also directly cause changes in the bicarbonate concentration. This is the first principle that you need to know. Respiratory and then metabolic, okay? Then we have acidosis and alkalosis. Now, if you are looking at acidosis and alkalosis, use the person's pH. So when you look at the person's pH, if it's less than 7.3, then it's acidosis. If it's more than 7.5, okay, or 7.45, then that one is alkalosis. Now with the acidosis and the alkalosis, it could be, what is causing the acidosis could be a metabolic cause. So because we said metabolic has to do with bicarbonate, okay? And we know bicarbonate is a base. So to get a metabolic acidosis, that means that your bicarbonate levels must be reduced. So something is causing the bicarbonate levels to reduce. If you have metabolic alkalosis, it means that something is causing your bicarbonate concentrations to increase. We said the respiratory types have to do with the partial pressure of carbon dioxide, okay? So if you have respiratory acidosis, that means that the partial pressure of carbon dioxide has increased in the blood. If you have respiratory alkalosis, the partial pressure of carbon dioxide has decreased in the blood, okay? Good. Now, there is a concept of compensation, okay? Now, as we said, when someone has when someone has I've already emphasized that when you talk about compensation, it means that what is happening to bring the pH back to normal. Okay, so there have been some disturbances. Okay, you realize that the person's bicarbonate levels have changed, the person's partial pressure of carbon dioxide have changed, but when you look at the person's pH, the person's pH is within normal range. Then this person has compensated. That means that something has happened for this person to maintain his or her blood pH within normal range. So that is compensation. So when you talk about compensation, you have derailments. You have derailments in the either the bicarbonate or the partial pressure of carbon dioxide, but the pH is within normal range. Then we say the person has compensated. Okay. Good. And I said that for the metabolic causes, the respiratory system starts the compensation, but that compensation is not complete. So later on, the kidneys will now continue and then complete the compensation. Okay. So if someone comes with a metabolic condition at the initial phase where the respiratory system is compensating, that compensation is not complete. Okay. Then I said that if someone has a respiratory cause, whether respiratory acidosis or respiratory alkalosis, the lungs does not participate in the compensation because now the pathology is with the lungs. So in this case, only the kidneys are going to compensate. Good. So here we are seeing that, let me just read this part. So renal compensation for respiratory disorders, okay, and then respiratory compensation for metabolic disorders. I have explained. If you have metabolic disorders, the respiratory system is going to compensate, and when you have respiratory disorders, the renal system is going to compensate. Okay, renal system for the respiratory disorders is very slow, though the kidneys are effective, okay, but they work very slowly. They take a lot of hours or even days to reach maximum. But the respiratory compensation, it occurs quickly. Okay, good. So I've given you differences. I have explained what metabolic disorders are and what respiratory disorders are. Then we've looked at metabolic acidosis, metabolic alkalosis. I said when you are talking about metabolic, you are looking at the bicarbonate levels. When you are talking about respiratory, we are looking at the partial pressure of carbon dioxide. Okay, good. And we've also seen the concept of compensation. That the kidneys are going to compensate when you have respiratory disorders, and then the respiratory system will compensate when you have metabolic disorders. Good. Now let's look at here. I mean, for this part, okay, try and keep the values in your head. Okay, I don't know whether maybe if you get a question, they will give you the normal range, but try and remember them. For H plus, the normal range is 35 to 45. Okay, that's the H plus concentrations. So if it's less than 35, not your H plus levels have reduced. So alkalosis. If the H plus concentrations are more, or the H plus concentration is more than 45, then you are in acidosis. That means that if the H plus levels are high, then that means that you are entering acidosis. Okay. I've said the partial pressure is between 7.35 and then 7.45. Good. Bicarbonates, 21 to 28. Just keep this in your mind. The partial pressure of carbon dioxide is 4.4 to 5.6, and the partial pressure of carbon dioxide is 12 to 15. They are all in kilopascal. Good. So let me go over this again. When you talk about metabolic, we are looking at bicarbonate. When you talk about respiratory, we are looking at partial pressure of carbon dioxide. So metabolic acidosis, low levels of bicarbonates, alkalosis, high levels of bicarbonates. Respiratory acidosis, high levels of partial pressure of carbon dioxide. Respiratory alkalosis, low levels of partial pressure of carbon dioxide. And later on, we will see that there are times where the person has both metabolic and respiratory. We call that one the mixed disorder. Now, what can cause metabolic acidosis? Okay. Now, for the metabolic acidosis, we can group them into two. We can look at the metabolic acidosis with increased anion gap. And I already explained this to you. Okay, I even gave you some examples. For someone with diabetic ketoacidosis, remember that the keto acids are anions. Okay, they are unmeasured anions, plus they are also acids. So they will give rise to acidosis. And because they are unmeasured anion, they will also increase the anion gap, as I explained in the afternoon. Okay, as well as someone with renal disease. If you have renal diseases, you retain the H plus ion, as well as you also retain sulfate and then the phosphates. The sulfates and then the phosphates are also unmeasured anions. So those ones, the presence of them will increase the anion gap. Okay, so these are some conditions. We also have lactic acidosis. Remember, lactate is also an unmeasured anion. So if it increases, because it's an acid, it will cause acidosis. Okay, and because it's an unmeasured anion, it will also increase the anion gap, including some drugs. Now, we also have some metabolic acidosis with normal anion gap. Okay, so this one is seen in what is called the hyperchloremia, where the person has high levels of chloride ion. Now, because you remember that we said the anion gap was equal to sodium minus, okay, sodium minus the sum of chloride and then bicarbonate. Okay, so if the bicarbonates, the chlorine levels are high, okay, they will tend to keep the anion gap normal. Okay, good. Now let's go to a condition. There is also another condition over here where you are losing intestinal fluid, diarrhea. If you have diarrhea or you have intestinal fistula, okay, where there is an abnormal connection between your intestine and the environment, you are losing a lot of fluid. Remember this principle. If I vomit, okay, I vomit H plus and then chlorine, because the stomach produces HCl, but the intestinal fluids consist of bicarbonate, because remember that the bicarbonate is produced by the pancreas into the duodenum. So if you are losing fluid from the intestine, okay, in the form of diarrhea, you are mainly losing bicarbonates. If you are vomiting, you are losing H plus ions. So someone with diarrhea, okay, will lose a lot of HCO3 bicarbonates, and that will cause the person to have metabolic acidosis. Good. Let's go to metabolic alkalosis. So metabolic alkalosis, as I said, vomiting. Now remember that, as I said, if you are vomiting, you are losing H plus. So if you lose a lot of the acid, then that means that there will be a lot of base inside your system. So that's the reason why vomiting causes metabolic alkalosis, whereas diarrhea will cause metabolic acidosis. Please remember this very, very, very well. Okay. Sometimes not only vomiting, sometimes we put a nasogastric tube or NG tube in the person's nose all the way into the person's stomach. Okay. And then we suction it. Okay. And whilst we are doing that, we are also bringing out H plus. It's just like the vomiting. Okay. And if you remember in the afternoon, I talked about potassium deficiency. Okay. If you have hypokalemia, what's going to happen? One, potassium inside the cell, the intracellular potassium, would like to move outside. Okay. So as they are coming outside into the blood, what's going to happen is that H plus ions will move into the cells, and in that manner causes metabolic alkalosis. Okay, good. Now let's go to the respiratory types. So for the respiratory acidosis, we have the acute type and the chronic type. The acute type are the dramatic ones. Okay, like someone who is choking, someone who is drowning, someone who has foreign body in the person's airway, or someone who has been pierced on the side and is having pneumothorax. These ones, they are very acute. Okay, they can cause acidosis. And the reason why they are causing acidosis is because you cannot breathe well. So the carbon dioxide remain in your system, and that causes respiratory acidosis. Okay. And we have the chronic type. The chronic type there, all the diseases of the lungs can cause respiratory acidosis, or the COPDs. I said for the COPDs, you are retaining a lot of carbon dioxide in your system. Okay. Someone with tuberculosis and then bronchial cancers too as well. In what state do we get respiratory alkalosis? So respiratory alkalosis occurs when the person hyperventilates. So this is a case where the person is breathing in and out very quickly. So when you do that, what's going to happen is that you are pushing away all the carbon dioxide. You are pushing away all the carbon dioxide. Okay, and we said that the carbon dioxide in itself is an acid. So if you push away all the carbon dioxide, then you have a lot of base inside you. So you entered into a respiratory alkalosis state. Okay, so overstimulation of the respiratory centers, anything that can cause the person to hyperventilate. Good. So we've said everything. Now, this is the last part of the slide and the most important part for your exam's sake. So now, this is how the question is going to be. They will give you a scenario and they will ask you to choose the metabolic state of that person. Is it A, respiratory acidosis, metabolic acidosis? So you should be able to look at it and then choose the correct one. Not only that, you should be able to tell whether it's compensated or it's not compensated. Okay. Now, how do we go about this? So the first thing is that the question that they will give you, the first thing to look at the pH. Okay, if they don't give you the pH, look at the H plus concentration. So from that alone, you can determine whether it is acidosis or alkalosis. Okay, but sometimes the pH is normal because compensation has occurred. So then what you have to do is look at the clinical scenario. Okay, now we have looked at the various clinical scenarios and what they cause. So for example, if the question is saying that someone is vomiting, okay, then in your mind, you know that if someone is vomiting, the person is losing H plus. So the person will go into the state of metabolic alkalosis. So you always try and then integrate the clinical scenario they've given you with the values that they've given you. Okay, good. So with that, you can determine straightly from those ones that whether your patient has a metabolic condition or a respiratory condition from the scenario that they'll give you. If they give you anything that has to do with the lungs, then it's a respiratory cause. For example, if they say someone has been smoking, or someone has tuberculosis, or someone has the respiratory system overstimulated, all those ones will point to the fact that it's a respiratory disorder. Aside that, someone who is having diarrhea, someone who is having someone who is vomiting, someone who has diabetes ketoacidosis, lactic acidosis, all those ones are metabolic causes. Okay, so that's the first thing you do. Then the next thing you do, okay, is to find out if there has been compensation or not. Okay, there has been compensation or not. So as I said, for most of them, the 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 compensation can be full compensation or partial compensation. Okay, full compensation. So when you say fully compensated, it means that the H plus has come to its normal range. Okay, there are times that the H plus could still be in the abnormal range. Okay, so that one is partial compensation. So now how will you know whether compensation is taking place? So for example, if I give a scenario of someone who is vomiting, in your mind, you know this person has metabolic alkalosis. Now, because this is a metabolic state, this is a metabolic state. Okay, this is a metabolic state. We said that for metabolic states, what is going to compensate? The respiratory system is going to compensate. So go and look at the partial pressure of carbon dioxide to determine whether it has compensated or not. Let me take this part again. If you are able to come up with the fact that, let's say, this is a metabolic condition, then what's going to happen is that you are going to you know that if it's a metabolic condition, the respiratory system is going to compensate. So go and look at the partial pressure of carbon dioxide to see whether it has compensated or not. Now, this is how the compensation works. If you have high bicarbonate level, okay, then you should have high partial pressure of carbon dioxide so that it compensates. Okay, so when you look at it and you see that the partial the bicarbonate, this is a metabolic condition. Let's say this is a metabolic this is a metabolic alkalosis. The concentration of bicarbonate ions are high, so it's a metabolic alkalosis. Okay, then quickly you go and check the partial pressure of carbon dioxide, because you know if it's a metabolic state, the respiratory system will compensate. So when you go and look at the partial pressure of carbon dioxide, and then the partial pressure of carbon dioxide has also increased, then you know that there has been compensation. So for compensations, they must move in the same direction. If bicarbonates increase, carbon dioxide must also increase. Okay, good. We have 10 more minutes to go. Now let's look at some examples. Okay, So this is the last part of the slide. Let's look at some example. So let me see. Okay, I'll be mentioning random names. If I mention your name, then you will help us to understand the condition. Okay, so let me see. Let me pick this person.
It's not like
Okay. Okay. Hey, most of you are using names that cannot be mentioned. Okay. Okay. Phyllis, I know you, so you help us with this question. Phyllis, are you there?
Phyllis, are you there?
Hey, no answer. Phyllis,
Where
I know
are
you are there.
you?
Hello,
Where
yes.
are you?
Okay. So read this question for us, and let's work it together.
Okay, so a man aged 60, a heavy smoker
Okay,
with chronic
it's okay. It's okay.
bronchitis.
End there. End there. Now,
Like,
now they are saying heavy smoker and chronic bronchitis. So in your mind, are you going to think about a metabolic cause or a respiratory cause? Phyllis, answer the question.
a respiratory cause.
Good. So a respiratory cause. So now that you are you are saying it's a respiratory cause, even without looking at the values, someone with chronic bronchitis, okay, should the person have respiratory acidosis or respiratory alkalosis? Yes, Phyllis, is your question.
The person will have respiratory alkalosis
Why?
because the chronic bronchitis will cause
Mm-hmm.
hyperventilation.
No,
Or
no, they don't have hyperventilation. They rather accumulate a lot of carbon dioxide because it is a COPD, right? It's an obstructive disease. So they can breathe in air,
okay.
but they cannot take the air out. Okay. So such patient, if you look at their chest look like barrel. So they have barrel shaped chest, okay, with a lot of carbon dioxide there. So Phyllis, come again with your answer. Would they have respiratory acidosis or respiratory alkalosis?
Wait, right, I'm confused.
Oh no, don't be confused. Okay, so we are saying that they retain a lot of carbon dioxide in their system. Okay, so if you retain a lot of carbon
Okay.
dioxide, so it will be respiratory what?
Acidosis.
Good, respiratory acidosis. So that's what I'm saying, that without even looking at the values, okay, the clinical scenario that they've given you itself can give you an idea of which metabolic state that is going to be. Okay, so we have respiratory acidosis. Now, the fact is that when you come and look at the H plus levels, okay, the H plus levels are within normal range. If you remember the values we gave, you can check it. But in this case, the H plus levels are within normal range. So what can be said about this? Okay, what we can say about this is that there has been some kind of compensation. Okay, now if I look at the partial pressure of carbon dioxide, the partial pressure of carbon dioxide is increased. Okay, telling me that this is actually a respiratory acidosis. Okay, then after I see that the carbon dioxide, so let's look at the steps. So the first thing is that looking at the condition, okay, I know that no, this is a respiratory cause. If it's a respiratory cause, the next parameter I'm going to look at is carbon dioxide levels. Then I'll come and look at the carbon dioxide levels, and I know the carbon dioxide levels have increased. So in my mind, I have respiratory acidosis. Then the next place I'll go to is the bicarbonate levels. Then I know the bicarbonate levels are 39. Okay, we saw that it's between 21 and 28. So if you have 39, then that means that the bicarbonate levels have also increased. And I said that anytime the increase is in both directions, if you have partial pressure of carbon dioxide increasing and partial pressure of bicarbonate increasing, then the increase over here is a compensation. Okay, then the last place I'll come and look at is the H plus. Then I know that the H plus is within the normal range. So that tells me that it's a full compensation. Okay, good. Now the order is very important because look at what someone is going to say. Someone is going to just start by looking at the bicarbonate level and say that, oh, the bicarbonate levels are high. So this is metabolic alkalosis. You are wrong. The reason why you are wrong is that, you see, you have to look at the partial pressure of carbon dioxide first, because the condition that was given was a respiratory condition. So looking at the respiratory condition, come and look at the partial pressure of carbon dioxide first. When you see that one is high, then you come and look at the the concentration of bicarbonate next. The only reason why I'm looking at bicarbonate here, okay, is just to tell me whether compensation has occurred or not. It's not for me to diagnose whether it's respiratory or metabolic. No, that one, the clinical scenario has given that to me. Okay, good. So I looked at this. This is a heavy smoker, chronic bronchitis, emphysema. In my mind, no, this is a respiratory problem. Then I come to the partial pressure of carbon dioxide. It's 9.5. Okay, it's 9.5. So this one is an acidosis. Good. Okay. Then I come to the bicarbonates. No, the bicarbonate is increased. So this one, the only reason why the bicarbonate has increased is just to compensate. It doesn't mean there's any problem with the bicarbonate. Good. H plus is within the normal range. That means that the compensation has become very effective. So if I put everything together, the diagnosis is going to be a fully compensated respiratory acidosis. Okay. Now, if you look over here, it gave the partial pressure of oxygen to be 7.5, which is reduced. Carbon dioxide is increased. So remember that we have remember the type 1 and type 2 respiratory failures that we talked about. We said type 1, only carbon dioxide is reduced. Type 2, type 1, only oxygen is reduced. And type 2, oxygen is reduced and carbon dioxide is increased. Okay, so with the oxygen that they gave over here, the only reason why they gave the oxygen is for you to add whether the person has respiratory failure or not. And yes, the person has respiratory failure. Is it type 1 or type 2? It's type 2 because the carbon dioxide levels over here have increased. So this is how we analyze this question. Okay, we have 1 minute more. Let's analyze the second question. Okay, let me call another person. Let me call Alexander Bonsu. Alex, take us through the second question. Please, the session is ending. I beg us, let's come again just for 10 minutes and go through the questions. Okay, just 10 minutes, then I'll end with you guys. Okay, I beg you. This one is ending. It's very important to go through the questions. Okay.